Good afternoon, David Johnson here. Just a quick video to talk a little bit about a very common condition or a common finding that's reported on MRI scans, and that is the bulging disc. Okay, now how do we interpret whether a bulging disc is relevant or not relevant in the management of someone who's presenting with low back pain? It's very often misinterpreted. The significance of a bulging disc is very often misinterpreted, and what I'll do is just play this little video from a very popular back pain education platform. Millions of people watch this video. It's from a couple of physical therapists in the US that have a lot to say about back pain. And in this particular video that millions of people have watched, they are talking about bulging discs. And you'll probably be able to get the idea why this type of messaging concerns me, because it instills a lot of misunderstanding in the significance of bulging discs in the setting of back pain. Now I'll go and explain that in a second as well, but let's just watch the video now and have a little talk about that. That's the next slide.
Right now, let's talk about the big lie. All right, first off, let's say you're having back pain, you go in and you have an MRI, and they found out you have a bulging disc or a herniated disc.
Sure.
And here you go.
So a lot of people will have pain, they'll go and have an MRI scan, and even having an MRI scan sometimes is like you're begging your doctor to get an MRI scan to have a look at the part of your body that's causing, that's associated with your pain. So sometimes you may experience that practitioners are reluctant to order an MRI scan because, oh, heaven forbid, we find out there's a bulging disc. Okay.
Oh my God.
Right, you're all excited.
You're
I
excited.
better get surgery.
I better have surgery.
Right.
And the thing is, that's probably the last thing you want to do, because the problem is, when you'll...
Yeah, sure, surgery is the last thing you want to do. No one wants to have surgery. Any patient that wants to have surgery is a red flag. And the job of surgeons really is to educate people how to not have surgery. The problem is we get patients often when it's a very long way down the journey, and at that time when we see patients, of course, well, the boat sailed, and implementing management strategies that can avoid the need for you to have surgery, those opportunities are lost. So surgeons our job is to teach people what to do to not have surgery, because we know what's involved when you have spinal surgery, and we also can, if we see you early enough, can advise you how to not need that spinal surgery. But unfortunately, as it stands, people are terrified to go to the surgeon because, oh my God, they're just going to offer me surgery. And that shouldn't be the case. Whether it is or not is a conjectural point of discussion.
This study, we're going to show a couple studies. It showed that most people some people at a certain age have a bulging disc and they have no pain at all.
Right, exactly.
So in fact, let's go right to this chart.
Sure, I think it's a good idea, Bob.
And then we'll show this,
All right.
okay? So if you have a bulging disc, what they did is they did MRIs on people. Can you see this, Lonnie? They did MRIs on people who were having no symptoms whatsoever.
Right.
They had no signs or symptoms of pain. Right?
Yep.
And they did it on people in their 20s, 30s, 40s, 50s, 60s, and 70s. What they found out is that 30% of the people in their 20s had a bulging disc.
No symptoms.
No symptoms.
Active people.
Yeah. 40% in their 30s, no symptoms. Had a bulging disc.
Right.
All the way up to when you're in your 70s, 77% of the people had a bulging disc,
right,
but no pain.
So when you hear that, you're immediately thinking that the bulging disc is not relevant. because there's a high percentage of people who have bulging discs with no pain. In actual fact, the study was pre-selecting people with no pain, so no one in the study had back pain issues, and they were then identifying how many people within that cohort had a bulging disc. So they've already confirmed that the bulging disc is not symptomatic. So of course there's going to be a pretest probability bias that the bulging discs are irrelevant, okay? But that is a huge misinterpretation, that if I do have pain and I have a bulging disc, that it's not relevant, because you've got a completely different circumstance. It's a completely different context. Now I have a patient who happens to have a lot of back pain and they have a bulging disc. So using the interpretation that these guys are describing to sort of paint this picture that a bulging disc is not relevant is completely unscientific and very misleading. So
It just gradually goes up with age.
So it's a part of aging. It's
Right.
a deterioration process.
It's like getting gray hair.
It's like getting gray hair, exactly.
So that's not inaccurate. The bulging disc can be part, a bulging disc and disc degeneration is part of the degenerative process, and part of the degeneration process is to acquire some loosening of the annular fibres, and that results in a little bit of bulging. That is normal senescence, that's normal aging, as he said, like getting grey hair and wrinkles. But that doesn't mean that grey hair and wrinkles that are inflamed isn't painful, okay? So now we're introducing a functional overlay on a normal aging process, and the functional overlay is whether inflammation is part of that bulging, and that's when the bulging disc is relevant, because we can now say it's a bulging disc with inflammation. And to just say that a bulging disc is not relevant is unscientific and unhelpful.
A few extra pounds.
Sure.
So are you going to have surgery when you get gray hair, Brad?
No.
Okay.
If we look at these two vertebrae and we're going to take it out and show a model of those, this cup represents one of the vertebra.
So now they're just showing a little bit of anatomy relating to bulging discs and how the biomechanical forces on the disc can create some bulging. So it's pretty interesting. They kind of just already dismissed that bulging discs have any relevance, really. That's the general message that's being conveyed in this bit of educational video, which is wrong. And here we go. Here we are now talking about what a bulging disc can do and what it looks like on their little spine model. So it's a little bit ironic that we're going down this path now.
The green ball represents...
The actual disc itself?
Right. So this is a healthy disc here. It moves, it has some mobility in it so that you can move your spine as we all do. But if you get a bulge, just kind of zoom in here, Lonnie, and see how we're, right where my finger's pointing, right there's a bulge starting, okay?
Now, they have to kind of talk about this because we know very well that a bulging disc that's pushing on a nerve causes neuropathic pain, motor sensory disturbances, i.e. like pins and needles, numbness, weakness, floppy foot drop, severe disability. So we cannot, and even these guys cannot discount the significance of a bulging disc when it comes to the bulge putting pressure on a nerve root or the spinal cord. But a bulging disc has a spectrum of pain and disability associated with it while it's inflamed before it causes pressure on the nerve root. So it's just so perplexing why the significance of a bulging disc is completely diminished in the absence, even though it can cause significant back pain and disability and the need for opioids to be able to get out of bed. That doesn't seem to be of any significance to these educators unless it hits the nerve. Okay, but we're talking about people with bulging discs, functional problems related to the inflammation in the disc, way before it causes neuropathic pain. That's a new problem. That's a neurological condition now caused by the bulging disc.
And particularly if it's in the back where most bulges are, when you bend forward, it oftentimes makes it worse. Or when you lift weights with poor body mechanics and seated with poor posture, and that bulge can eventually, boom, turn into a herniation.
A herniation is when some of the inner material of the disc actually spills out back behind there.
A disc is just like this. You can see there's material in there it's liquid, kind of a thicker liquid, but it can come out and cause that bulge, and that's a problem that you do not want to have.
Well, it's a problem that is not really a problem unless it pushes out the back and hits a nerve, Brad.
Right, exactly.
That's exactly wrong. It is not just a problem when it hits the nerve. When the disc is unhealthy and painful and inflamed, it is a problem. It's just the spectrum of the journey of the disc deteriorating in its health, and later on it can then put pressure on the nerve and then cause neuropathic symptoms. But well before it puts pressure on the nerve structures, it can cause severe back pain and disability. So that's just completely a ludicrous, ridiculous statement.
I meant to say was went far out, and and creating pain and whatnot.
So when should you have surgery? There are times you should.
Right.
One is if this bulge or herniation is pushing against your spinal cord, which is running right down this hole here. The other one is if it's hitting one of the nerves coming off on the sides. If it hits that nerve, it would actually could give you some pain down your leg.
So that's the only time you're meant to have surgery, is if you've got neuropathic pain, sciatic pain, foot drop. If you're in severe back pain and disability, they're basically saying just don't do anything about it. The bulging disc in that circumstance is completely irrelevant because of this 2015 study. And this is the study here. It was done in 2015, and these are the statistics that show normal people, pre-selected normal people with no back pain, and the prevalence of disc bulges in the various ages, okay? And in actual fact, they came out with a second part of the study a little while later, and they showed that that disc degenerative changes and bulges in populations that did have back pain were even more common. So that diminishes from the statement or the interpretation that a bulging disc has no significance, because when you take a new cohort of people and you identify this new cohort to have significant back pain and disability, then you can see even higher rates of bulging discs. So there most certainly is going to be a correlation between bulging discs and the presence of pain and disability, even if you take but that may not resonate clearly if you just look at this study in isolation. And the example that I've talked about here in terms of pretest probability is this this example of something like smoking cigarettes, right? If you walk down the street or in a shopping centre and you see people smoking, and everyone looks quite healthy and they're smoking, and you get the idea that smoking is absolutely fine. Look at them, they're enjoying their outdoor lifestyle and activity and they're smoking cigarettes. There's no problem. But if you then go into the circumstance or the context of, let's go to an emphysema clinic or a lung cancer clinic and ask everyone who has lung cancer whether they smoked. Now you go, yeah, I smoked, and 80% of the room puts their hand up and says, yes, I used to smoke. And they're all in a lung cancer clinic. So it completely switches the interpretation of the observation. Now you say, sugar, smoking is really harmful. It causes lung cancer because I've altered the pretest probability. Another example, and I say this to my son, riding motorbikes. Just drive down the street and look at everyone riding motorbikes. They're all having a gay old time riding their motorbikes, paying hardly any petrol, and it's safe as houses by that interpretation because they haven't had a crash yet, right? So you would think riding motorbikes is just Jim dandy fine. But if you come to the hospital and come to my intensive care unit department and look at all the head injuries and say, what was that guy doing? What was that guy doing? What was that person doing? You suddenly see that there's a very high proportion of people who are riding motorbikes. So the context of the situation has completely changed. And now you go, sure, riding a motorbike is highly dangerous. Okay, so you can clearly see the misinterpretation that these guys are doing by taking this cohort of people who have no back pain and saying that their disc bulges are irrelevant. The very important take-home message, final message, is that yes, it is normal to experience degeneration of the spinal structural integrity as you get older, but that is not correlated with pain. Degeneration is normal, it's pain-free, and it's part of aging. But if you have accelerated degeneration, if these degenerative changes are occurring faster than they would otherwise normally occur, that is pathological, and it will most certainly be associated with pain and disability. And the functional aspects of inflammation will be associated with that disc, even if it is bulging and even if some of the studies say it's not relevant. Or even if some of the studies' conclusions or people's conclusions of the studies is incorrect, and it is relevant because the biomechanics associated with the discs, will determine whether inflammation is in that disc, whether it's bulging or not. And if inflammation is in the disc, I can guarantee you are going to be suffering from mechanical low back pain or discogenic low back pain. And clearly I improve the biomechanics with functional movement therapy, which is what we refer to as neurorehab. I eliminate the inflammation. Now I have a healthy disc, and yes, it doesn't matter whether that healthy disc is bulging or not because it's healthy and it's not painful. Okay? Whew. Hope that makes sense. And talk to you next time. Thanks a lot.